I think
right?
one of the key things I've dealt with over the years is I understand the space for traditional Thai massage, for instance, since that's the discipline I kind of come out of. But I'm most interested in how does it adapt in the Western marketplace? How does it continue to flower and develop
Right.
and continue and like broaden? Because even Western bodies, I think, are different than Thai bodies. We sit in chairs, not on the floor.
Yeah.
Different degrees of like hip mobility.
Yeah, we don't squat.
Yeah, I come in like a little bit of an alien because I go, hey guys, and this is the fundamental innovation. I say, put away the table and let's work on a mat with a person who's clothed.
Yeah.
Just that is so different than what most educators or students or massage therapists are putting out as massage, that it creates a bunch of, I think, benefits, but initially it looks like impediments to practice where it's like, this is weird. Like,
Right.
I got to use my feet. I don't know. Like, my clients want massage. And it's like, no, your clients want what they have been sold
Right.
and what your
Right.
culture has already got an acceptable box for. But
Yeah.
even adding something like cupping, it starts to expand upon and allow that box to broaden just a bit. New
Sure.
tools. Like I saw a debate yesterday in a forum where they were arguing about massage guns and how it's, a real professional wouldn't use that. And I'm
Why not?
like, you don't want more tools? Like, I don't teach cupping because
Yeah.
I don't know it well enough to feel confident doing so. But students will sometimes come to me with things like that, kind of use a massage gun or cups. And I go, sure, just make sure you're studying with a qualified practitioner and figuring out how to package it within the service. But
That's
I'm
right.
generally in favor of giving the therapist more tools.
Well, absolutely, because there are. I always think of it as there's really interesting dynamics within a profession, and this is in any profession. You've got purists who only use their hands, only do it on a table, only do it with the person nearly naked or nearly dressed. Like there, it's a very parameter. This is what massage therapy is. And then there's people like you and me that says, well, the reality is if I injure my hand and I can use a tool to continue doing my job and do it just as effectively and sell my patients that this is still a massage, well then whether that tool is a massage gun or whether it's a cupping set or an ISTM tool like Graston or ProStim or whatever, I think that ability to expand our interaction with our client or our patient and just do our best for the patient is the most primary thing. It's really it's an interesting place. I
Interesting.
think cupping, just like any other tool, I do it weird too. My practice, I don't use glass cups and I never fire cup. I use a like silicone. I have a couple here, just silicone cups,
Yeah.
and I have the vacuum cups, right? And I use these all over the time, all over the body. And I'll put them on, I'll move them around sometimes. But most of the time, what I like to do is I put them on and make my patient move.
Yeah.
And make your patient move, that's crazy talk,
It's
right?
not to me, but
Well,
I think
exactly.
I sense that we're a little more on the same kind of wavelength.
Probably.
Yeah.
Yeah, I've taken a couple of your online courses and I appreciate your work because you do have your patients moving. Just the way you practice as a on the mat instead of on the table, you are inherently going to move the patient because it's easier because they're never going to fall off the table.
Yeah.
Why would I not stretch my
Yeah, I
patient?
was having a conversation with another educator, and they taught a class to some massage envy group somewhere. Like, I won't name
Yep.
the state to out them, I guess. But the students were having a hard time with his clothes on work, where they just had shorts on, and I think they're mainly working on the legs. And they were asking afterwards, well, how do I use this with Swedish? And he's like, okay, do the Swedish move and then do the move I taught you on the shin, on that part of the body. Just kind of go toggle back and forth.
Right.
And he was very clear to me that he's like, I felt your frustration, Robert, because he's like, I don't think they got it. Like it started to not conform to, again, what I always say is what they were taught in school.
Right.
And I always go, listen, if you want a better massage, I might not be the teacher for you. If you're trying to solve a pain relief and mobility problem, we're going to work well together.
Yeah.
Like, I'm not saying my work isn't massage, but that's what the rest of the industry tells me consistently. And every time it happens, I go, well, great, we don't need licenses in all 50 states.